People's Community Clinic is a full-service family practice, founded in 1970 in a church basement and open just a few nights a week, staffed by volunteers. Since that auspicious beginning, we have really come a long, long way.
We are a patient-centered medical home. We care about a lot of the holistic elements of healthcare, just beyond treating sickness, but going towards wellness. And I think that has had a broad impact on our patient base and the community.
I was sick, very sick when I arrived here. I was in the hospital for several months, 5 months in fact, due to a back injury. I was paralyzed from the waist down, and I had 5 different surgeries. One of those surgeries resulted in an infection that went up to my brain, and so I had bacterial meningitis. I had to learn to brush my teeth. I had to learn to put on my socks. I had to learn to walk again. And so when I arrived here at People's Community Clinic, my doctor noticed that, hey, you look a little depressed. And I'm like, I am a little depressed. I mean, who wouldn't be, right? And so she was like, we can help you with that.
We have been successful in achieving patient-centered medical home status, which is, in my mind, kind of looking inward at our patients and what their specific needs are and trying to address them.
They had somebody in-house, and the whole process was kind of quick, and so now I have my therapist working with my doctor to make sure that all my needs are met.
People's has a huge impact in the community. We serve tens of thousands of patients. We are that safety net that enables people who are lower income, people who don't have access to insurance, to get the health care they need. You know, we're creating a situation where we can make health care a right rather than a privilege.
In my faith tradition, we have a concept, and I'm Jewish, we have a concept called Tikkun Olam, to heal the world. And the way we understand that is that it's not our job to complete the work of healing the world, but it is our responsibility to participate in that work.
Matthew 25, Jesus is talking to a group of people, and he's telling them, you know, you're going to be blessed because you helped me. And they said, well, when did I help you? We don't remember helping you. And he says, you know, when I was sick, when I was locked up, you visited me. You know, when I was naked, you gave me clothes. And they're like, when did that happen? And he says, when you have done it to the least of these, you have done it unto me. And that is what People's Community Clinic is doing. They are giving it to the least of these people who have no insurance or are underinsured, or just, you know, having some problems in life. Maybe they have insurance, but because of their financial situation, they're not able to maybe meet some of the co-pays or get the prescription they need. Well, they can come here and receive that help.
I've had good doctors. I was really surprised at the quality of the care, the compassion, the empathy, the expertise demonstrated by the providers here. And I came away quickly feeling like this is the best health care I've ever received.
There's very few places that adults can receive dental care because it's not part of Medicare, it's not part of Medicaid, and it's not part of MAP. So someone has to provide it at minimum cost. We have a program that we help get people colonoscopies. The food kitchen. I mean, there's just so many programs here. You come to this class, we're gonna teach you how to do it, we're gonna give you the groceries, we're gonna give you the grocery list, we're gonna give you the cookbook. I mean, all these things are integral to good, healthy living, to good, healthy lifestyles.
It's hugely important. If you're truly going to be a patient-centered medical home and really understand all the social determinants of health, you have to know the person. You can't be treated like a number. And in order to know that person, that patient, it starts with trust building, dignity, and respect. And so that's built into our culture.
Our world is in need of love, compassion, empathy, and right now it's a lack of it, but People's is here.
One thing that I really noticed when I first became a patient was I felt like I was actually cared about. My providers were asking me, how am I living? And what am I doing? And they've worked with me and collaborated with me, understood my points of view on healthcare, and brought expertise to the table to help me to live my life the way I want it to be, and also to be the best life with their guidance.
If it wasn't for People's, you know, I might still be stuck in my depressive state. I don't know. It was a big struggle to get back on my feet, and I'm just thankful to God that people were here to help me literally get back on my feet. And you know, if it wasn't for Peoples, man, I'd probably still be in a pretty dark place. Is life perfect? No. But am I in a much better place because of Peoples? Yes.